This video will show you how to use a repositioning sling to boost and turn in bed using a single track lift.
This video demonstrates one method. If space does not allow for bed movement, an assessment for alternatives may be required. The client has slid down the bed and the lift cannot be used because the client is not directly underneath the motor. The bed needs to be moved up so the client is in the correct position underneath the motor. Push from approximately waist level. Coordinate the move, take a step stance and push using the strength in your legs. Reapply the brakes. Adjust the bed height so it is between the hip and waist of the shortest caregiver. Connect the loops of the repositioning sling, coordinating which loops you're going to select. Make sure that the sling supports the client's head and to at least their mid-thigh. You can also give the client a pillow under their head for more comfort and support. When it's safe to do so and check in that all the sling straps are properly attached, you can lift the client. The bed then needs to be moved back down. Usually it is easier to push rather than pull. You may have to pull if there is not enough space. If there's two staff members, coordinate with each other, take a step stance and shift your weight back. Lock the brake. Lower the client into the bed. If you are planning to turn your client, you need to position them slightly to the side. Remove all the sling straps from the side that you are going to turn the client towards. Position the client ready for the turn. This means either lifting their knee or crossing their leg. Also position the client's arm on the side that you are going to turn them towards so that it is free and does not get trapped when you turn them. Turn the client by pressing the up button of the hand control. If you are the person controlling the turn, make sure you're standing at the side the client is turning towards so you can watch how far they are going over. Once your client is fully turned, position your client with pillows, lower the motor and remove the carry bar straps. Flatten the repositioning sling, lower the bed and leave your client safe and comfortable. Thank you for watching. For more safe client handling resources, please look in the description box below.